Well, those patients are very lucky. In the past, we've been fairly limited in what types of hair loss products we could use. Some people have used a topical Rogaine for male pattern baldness. Some people have been using finasteride or Propecia, which is an oral pill to stimulate hairs to grow. But now there's a new treatment called PRP. PRP stands for platelet-rich plasma. And what is being done is we can take a patient's own blood and then we centrifuge it down and isolate a layer of plasma that is very rich in platelets and growth factors. And what we do is we take that layer and we re-inject it into the scalp. And what this new product does is like Miracle-Gro for men's hair and female pattern baldness as well. And the hairs are regrowing, we are stopping shedding, and the hairs that you currently have are increasing in their thickness. So this is a fairly new treatment. It's not FDA approved as of yet, but we are having tremendous success in treating both men and females for male and female pattern androgenetic alopecia. The most expensive way to get your hair back is using hair transplantation. It is the most effective way, but most of the time that will cost somewhere between $10,000 up to $25,000 to regrow a nice subset of hairs. And this new plasma treatment is very reasonable. The treatments run at about $600 a treatment, and patients start off with a package of 4 treatments. They do them monthly, and then once they get their hairs growing, you do this once or twice a year to continue the stimulation of your hair. The treatment's very well received. It's very easy and non-invasive. It's done by a blood draw here in the office. We take a large tube of blood from the patient, which is fairly painless to take blood, and then we spin it down, and then we just use a little bit of cold air to re-inject the plasma back into the scalp. So the only side effects that we've seen are mild discomfort on re-injecting the scalp with the plasma, and then occasionally a little bit of pinpoint bleeding, which really stops very quickly with just a little bit of pressure from a gauze. Other than that, there have been virtually no complications and no side effects of doing this treatment. So we now have an easy, non-invasive way to stimulate hairs to regrow. Unfortunately, these treatments are cosmetic. Most insurances consider male and female pattern baldness as a cosmetic condition. So this is an out-of-pocket procedure, but still very reasonable when you compare the cost that people spend ongoing for expensive lotions and potions and hair transplantation, which is the gold standard for hair restoration and for men and women. But that is quite tedious, and you have to spend hours isolating little follicles, 1 hair units at a time, and it's a full-day procedure where patients have to get shaved to get the harvesting done, and then put the hairs back into the scalp, and you have little surgical wounds for several weeks to months afterwards. With this treatment, a patient can have it done in the office in probably 15 to 20 minutes and go right back to their normal activities and right back to work, which is a tremendous advantage.